My name is Francis Tembo, all the way from Kabanana, Lusaka, Zambia. I have a question for you today. How is mental health care being integrated into HIV and AIDS clinics to support those facing double stigma?
Thank you once again, Francis Tembo, for the brilliant question. You are asking your question on how mental health is being integrated into HIV management so that people who are living with HIV don't suffer that stigma. In the first place, I would like to recognize that indeed mental health is a very, very important component in the management of HIV. And people living with HIV suffer a multiple effects of it, ranging from the diagnosis itself, where maybe someone is tested and they are found to be positive. Secondly, they have also to deal with the fact that once found to have this disease, it's a lifelong disease, meaning that it doesn't have cure. Someone has to live with it. Thirdly, also is also to deal with the social stigma. A person may not be free to talk about it, and they will also feel some limitations in terms of interaction or withdraw from other social activities. And fourthly, again, a person who is living with HIV has to deal with the everyday taking of medication, which tends to be more like a routine, which someone should live along with it. Above all, to some extent, others may start dealing with the side effects of the ARVs. All these sometimes can be lumped together to become a serious burden for someone to live with it. And these are some of the introspections or other perceptions which people, once diagnosed, they need really to be handled with utmost care, and mental health plays a key role in sustaining their well-being, and also bring that confidence, and also bring that belief and acceptance so that they can live with it and adhere to the treatment. So coming back to your question now, how is mental health being integrated? Ministry of Health and other stakeholders have really invested in integrating mental health into HIV. I'm sure you are aware that pre-test and post-counseling is a routine. Pre-testing counseling is meant to ensure that a person is prepared, and they are also psychologically prepared to accept if, for example, they found that it's positive. So currently, how we have integrated mental health into HIV routine is again from the foundation itself. At the point of screening, when you go for testing, definitely you'll be subjected to counseling. So that counseling is part and parcel of a mental health component that is very key, because it tries to work on your psychological strength so that you handle it well. And also, I think Ministry of Health has also developed some guidelines, treatment guidelines for those who are living, so that they can also be supported psychologically. They are day to day, they are checked upon, day to day they are talked to, so that they are able to become resilient and be able to manage the other negative impact of living with HIV. And secondly, we are also implementing an approach that is really a holistic. We use it to manage other conditions such as substance use, so that people don't resort maybe into substance use to deal with the other internal struggles, because we have noticed that again, people who are living with HIV, of course, taking into consideration what I explained earlier about the multiple effects of it, they resort to indulging into substance use as a coping mechanism. As such, also it disturbs the adherence to treatment, and the medicine sometimes don't work properly. So we have an approach that we call common element treatment approach, that encompasses other behavioral patterns and other psychological interventions, just to strengthen the mental resilience of an individual, who is living with HIV and on treatment. And it's a routine now that every person who is on HIV or who is living with HIV or on treatment should routinely be subject to counseling, and counselors should be made available. Previously, we used to have counselors who were called HIV counselors, but currently, Ministry of Health has developed a particular counseling manual. We call it Basic Psychosocial Counseling Manual. We want to recognize counselors as counselors, not to have another name such as HIV or to be specific to HIV, because HIV, a person living with HIV will come with other psychosocial challenges that go beyond just a mere testing or on HIV. So we want to capacity build, and we have the process already started. We are in capacity building psychosocial counselors so that they are updated with the current trends and current approaches that are really effective in managing a person with HIV. So trainings are ongoing. So far, we have really trained quite a number. These include also the lay counselors that have been existing. They are being updated now. We are also training general practitioners. These are clinical officers, registered nurses, public health nurses, and also even caregivers as well. They are being given these skills and knowledge so that they are able to support an individual both at home and also when they go to the facility. They are able to receive this holistic package of services ranging from general to other other non-medical services such as the mental health counseling. So it should be also understood that currently mental health is just one of that key component in the holistic management of an individual, not necessarily maybe HIV, even in other now disciplines such as cancer management. You know that when a person is diagnosed with cancer, can equally experience psychological disturbances due to maybe the nature of the conditions. Even those who are experiencing amputations. So mental health is being integrated. It's a cross-cutting issue. So we are taking mental health in all the other disciplines. It's good that you have asked this question, Francis from Ngombe, and it's really a very timely question, and it used to be known that mental health now is being integrated in these other disciplines. It's a cross-cutting in surgery, in maternal health, in child and in maternal and child health. Mention them, you will find that mental health plays a key role. So we are integrating this in all this, including TB actually, because it's also a chronic condition. Thank you so much.